Hello friends, today we will talk about schizophrenia. It is a chronic, severe mental disorder that affects how a person thinks, feels, and behaves. It is not split personality. This is common misconception. Instead, it involves a disturbance in reality perception. It usually begins in late teens to early adulthood and affects about 1% of population. Positive means added experiences not normally present. Hallucination. Most commonly auditory, hearing voices, can be visual, tactile, or olfactory. Delusions. False and fixed beliefs. Common types. Persecutory. Someone wants to harm me. Grandiose. I have a special powers. Referential. TV is sending me message. This is all delusions. Disorganized speech. Loose association. Incoherent speech. Disorganized or catatonic behavior. Bizarre behavior. Agitation or immobility. There are reduction in normal functions. Alogia. Reduced speech. Lack of motivation, inability to feel pressure, all are schizophrenia disease symptoms. Reduced emotional expressions, social withdrawal. Negative symptom often causes most functional disabilities. Cognitive symptoms, impaired attention, poor working memory, difficulty in planning or making decisions, slowed processing, lack of confidence. Sometimes biological factor also affects schizophrenia. Genetic component if relative has schizophrenia. Imbalance in neurotransmitter, particularly dopamine. Structural brain changes. Complication during pregnancy, infection, malnutrition are all causes of schizophrenia. Stressful life events. Sometimes environmental triggers also. Some stressful life events. Substance use like cannabis in adolescence, it increases risk. Urban upbringing, social isolation. Sometimes environmental stress also are the cause of schizophrenia. At least two like delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms are all causes of schizophrenia. Present for at least 1 month for continuous sign for 6 months. Reduction in functioning. Sometimes clinical diagnosis can also detect. Sometimes medication. It goes on. Sometimes generation also it passes this disease. Help manage positive symptoms, less effective for negative and cognitive symptoms. Psychological intervention. Sometimes cognitive behavior therapy, family therapy, skill training, supportive employment and education. Cognitive remediation therapy, relapse prevention. Sometimes it relapses. Medication adherence, commonly support program. Early intervention improves long-term outcomes. Sometimes its recovery is good. It improves, requires ongoing support. It has persistent symptoms. Early treatment, strong social support and good medication, it responses improves prognosis. Schizophrenia affects thought, behavior and emotion. Features include hallucination, delusion, disorganized thinking and negative symptoms. It has biological and environmental causes. Treatment combines medication plus psychosocial support. Early diagnosis leads to better outcomes. Sometimes schizophrenia goes on to medical and also social support. Sometimes it lasts for so many time. It is chronic and severe mental disorder. It affects how people thinks and behaves. So if supportive environment, positive environment, stress-free environment can help to reduce it. Sometimes it is genetical and sometimes it is environmental, times it is due to structural brain changes. Sometimes it is due to dopamine, neurotransmitter. Sometimes it is due to complication during pregnancy. Sometimes stressful life events and substance use, social isolation. So social support can reduce it. Thank you.